Well, first of all, it's day one of 12 to 15, and what we're really focused on at this point is making sure that the information we get out to the pediatric community and the primary care community, as well as to many of the folks who are part of our vaccination network, is there and available for them to support people signing up. There are a bunch of 12 to 15-year-olds who've already pre-registered. I'm sure a lot of folks are going to reach out to their pediatricians and to their healthcare providers. Some folks may even go back to the places where they got their first vaccine for them as an adult and find out if there's Pfizer available for them, for their kids. I think issues associated with sort of the fall, what we really want to do is make sure we get as many people who are eligible to get vaccinated and get them vaccinated in a way that's convenient and accessible to everybody. And I would just point out once again, they're deemed already through proven demonstrable data to be enormously effective, and they're free. And we're going to do everything we can to make sure that there are plenty of places available for people to get them.
So no mandate, no plans for mandate?
No.
How about in terms of clarify, so tomorrow people will be able to sign their kids up on the website starting tomorrow Thursday?
Well, there's some folks who've already pre-registered, but certainly, I mean, people can pre-register today, they can pre-register tomorrow. I would expect some folks are going to hear from their healthcare provider on this. I fully expect that the regional collaboratives will start putting together programs, probably in some cases with their Board of Health, the folks they currently use for their vaccine program, and probably with some of the schools.
I know you sort of said you're going to wait and see, but do you anticipate what will it be like when these folks do get, the children do get, teenagers do get vaccinated? How do you think it will work? I know you said you're working on it when they get to prove you'll do it, but what's the anticipation of how that will work?
I think honestly the process will look very similar to the one that adults got vaccinated on, because for the most part, most of the network is going to be pretty similar and pretty consistent with what we've used so far. We'll probably be looking for people to sign up for a second dose to get an appointment when they show up for a first dose. I do think you'll see more participation from the primary care community and the pediatric community, because in many cases they have very tight relationships with a lot of the kids we're talking about. But we're also going to continue to put a lot of this product into the networks that we've developed in the 20 most hard-hit communities, and work pretty hard to make sure that we're making it available not just to adults in those communities, but also to kids who fall into those categories as well.
Governor, you talked a little bit about vaccine reluctance. Maybe some older people are wait and see, but a lot of those people are just, no, I don't trust it. So how important is it to get the kids involved and then get toward the herd immunity that we talked this stuff on about?
My view on all of this, and I think there's some practical experience about it at this point, is the more people we get vaccinated, the more opportunities there are for people who might be hesitant or suspicious or skeptical to run into friends and family and coworkers and other people they know, neighbors who've gotten vaccinated for whom it has worked. And I think in many respects, part of our objective here, now that we've got roughly 75% of our adult population vaccinated, and a whole opportunity here to continue to vaccinate younger folks, is to do everything we can to not only create a delivery model that makes it possible for people to access vaccines, but also to make sure that it's going to be very hard for a lot of people not to know someone who's gotten vaccinated and feels pretty good about it.
How do you think this is going to go? 400,000 people is a lot of people. We've seen that happen before, but right now, I mean, you can walk in anywhere and get the shot.
That's a good thing, not a bad thing.
They're making like announcements over the loudspeaker.
Yeah.
So I guess I wonder, do you expect like lines again? Do you expect the system to get a little jammed up?
Look, I think we do have capacity, right? That's a really good thing at this point in time, and we have supply. And I think from our point of view, we're going to work with our network of vaccinators to do what we need to do to make sure that the process can work for people, whether they pursue, you know, an email or a text message they get from their provider, or they get from the healthcare system they're familiar with, or they get from their pre-registration. The bottom line here is we have a lot of capacity. We have available slots for people. The pharmacy system certainly does. I think you'll see some of the pharmacies work together with some of the regional collaboratives, and probably some of the schools as well. I mean, there's going to be a lot going on here, and I think we'll be able to come up with a model here that'll make it possible for everybody who wants to get a shot to get one.
Last question. Governor, on another different topic, there's a letter circulating around prominent Republicans in the country saying that they're going to form a third party if the GOP does not disavow themselves from Donald Trump. Have you been approached about this letter, and if so, would you sign it?
I haven't been approached about it, and I've been a Republican since I was 20 years old, and I continue to believe in what I consider to be sort of the core values of the party. I've had my differences, as everybody knows, with plenty of folks in the party over the course of the time that I've been in public life, but I'm a big believer in what the party fundamentally stands for, based on what I believe it stands for.
Cheney did say that she believes the Republican Party is abandoning the rule of law and democratic principles. Do you believe that's true?
I made very clear that I felt the election process that took place back in November was fair, and that President Joe Biden won the election. And on those issues, I believe Liz Cheney is absolutely right.
Can you talk about your experience yesterday, your conversation with the president, how that went? And there was obviously a show of bipartisanship from this. Can you share a little bit about what you took away from that?
Well, first of all, he mentioned during the call, the president mentioned during the call, that governors tend to be a lot less partisan. That's true. I mean, I talk to Republican and Democrat governors on a pretty regular basis, the same way Secretary Sutters talks to secretaries of Health and Human Services in other states, the same way the Lieutenant Governor talks to her colleagues in other states, because in many cases we have very common problems we're all trying to solve. And over the course of the past year, there's been a tremendous amount of both scheduled and unscheduled and informal conversations and dialogues between and among governors. I mean, we've had, at one point in time, we were having weekly conversations with staff and elected officials in the Northeast, some of which was structured, scheduled, and some of which was literally pick up the phone and call. And I think in many ways, one of the things I like about playing this role as governor is the fact that most governors will pick up the phone when you call them and help you try to solve whatever problem it is that you're trying to solve, and vice versa, because we have a lot of commonality on that. And I think in some ways it's something I wish there was a lot more of at the federal level. Well, the gas issue, obviously in the South, is enormously problematic. At this point in time, it's not an issue in the Northeast, and that's primarily because a lot of our distribution comes from other sources. But we're paying a lot of attention to it.
Governor, really quick, can I ask you about high school sports? You've watched your share of high school sports.
I couldn't hear you over Aaron, so.
I'll try to speak louder. No one's ever told me to be
Yeah.
quiet. High school sports, Little League sports, kids still have to wear a mask on the pitcher's mound. They're supposed to sanitize baths, and yet restaurants are told they don't have to sanitize the ketchup bottles anymore. It seems like a disconnect. Some parents are writing me about it. Is there any way that that could be loosened up a little?
We're working on it. We're well aware of the issues. We've been following the changes in a lot of the data coming out of the CDC and some of the most recent studies. And we'll have more to say about it soon.
Yeah, I wanted to ask, some of your Republican cohorts in other states are canceling the extra $300 in unemployment benefits, saying people are not going back to work. Here in Massachusetts, unemployment is still more than double what it was pre-pandemic.
Yep.
Business leaders are saying getting people to come back to jobs is a problem. Have you thought about maybe canceling the extra benefits, or is that something you're considering?
Well, Massachusetts, as I think we all know, is a very high-cost state. And the vast majority of the people who were most profoundly impacted by the pandemic and by some of the rules that we put in place were what I would refer to as working people. And what I would really like to do is to continue to see people get vaccinated, continue to see the drops in our public health data that we're looking for, and be able to move forward to aggressively reopen our economy, create the jobs for people, and then let people find their way back to work. But my biggest concern about this issue in a state like Massachusetts is we have very high housing costs. Food prices have gone up. We have high costs generally, and most of the people who've been most profoundly impacted by everything associated with the pandemic are folks who are not, for the most part, even at the median end, much less the upper end of the wage scale. And they have, they have rent to pay, they have utility bills to pay. What I want to do is get them back to work by continuing to reopen the economy and creating jobs and making it possible for them to do that.
Thanks, everyone.
We're still following the data, and we will be back to you on that one. I mean, we were very worried because many of the governors that we talked to and a bunch of the Health and Human Service secretaries that Secretary Sutters talked to said their demand for vaccines just stopped. I mean, it just fell off the table. Ours has gotten a little sluggish, but it has not fallen off the table, and I fully expect that a lot of those open slots are going to get picked up by 12 to 15-year-olds, and hopefully some of the outreach work we're doing is going to bring some additional adults into this thing, and we'll continue to get people vaccinated. But for me, and I think for the LG, the fastest way back to reopening is to continue to get people vaccinated, continuing to get continued improvements on the hospital and case count data, and that's really the thing we're paying the most attention to.
Thank you.
Any comments about 0 deaths yesterday?
So what?
Any comments about 0 deaths yesterday?
Well, obviously, any day that the COVID doesn't take a life is worth noting. But the other thing I would say here is, and this is again, evidence of the power and the importance of these vaccines. The death data generally, day after day after day, since the vaccines really started to take hold among that over 65 population, has gone down precipitously to the point where we've had 7-day averages now that have been under 10. We had nothing like that through most of the summer, the spring, the summer, and the fall, and the early part of winter. And a huge part of that is the success that those vaccines have had in protecting people over the age of 65 and folks with comorbidities for whom that COVID was most dangerous. And that's real life experience right here in the Commonwealth. And yet again, another example of why it's so important for people to get vaccinated, because this stuff works.
Thank you.
Thanks.